Hello everyone, my name is Dr. Priyanka Saokar Navale. I am owner of Deccan Dental Clinic, which is now known as World Class Dental Clinic, and I am shooting this video especially for the patient who complains about sensitivity. They have too much of sensitivity when they eat hot, cool food stuff, and they ask us what are the major treatments or what treatment they should undergo. So there are basically three treatments we advise for patient at our clinic when they have too much of sensitivity. If it is related to most of the time, why sensitivity occurs because the certain part of your tooth is exposed, like outer layer of enamel. When it goes off, the dentine is exposed. At that time, as we all know, the dentine has odontoblasts are located near the pulp. Okay, so this extension of odontoblast are there in the dental canals. So dentine has small canal like structure where this extension are there, and those canals are filled with the fluid. So because of that, whenever some hot cold food stuff comes, that fluid movement in return gives neural stimuli, and we get that sensation, that feeling that something is hurting. Okay, so how to prevent the sensitivity? If in case sensitivity is there, what are the basic treatments? So first treatment, most of the time when it is not related, we are talking all this when it is not related to cavities. Okay, otherwise for cavities we have already seen there are typical treatment like composite filling, GIC filling, which we have already spoke about. This is typical dentinal sensitivity or teeth sensitivity. How to prevent it? That time, first treatment what we do, we advise patient to use some anti-sensitivity toothpaste like Sensodyne, or the toothpaste which contains potassium nitrate or thermosil, something like that. Okay, so basic content of this toothpaste is same, like most of the time it contains potassium nitrate, then sodium fluoride. So what it does exactly? So there are these tubules that those are filled with the fluid, and they are the one reason for the getting that sensation that something is hurting. With the help of this ingredient, potassium nitrate or sodium fluoride, the tubules are blocked or it becomes very narrow, so that those sensation don't pass that instantly. So whenever we are advising thermosil or Sensodyne, basically they work on the same mechanism. They try to block those dentinal tubules. So that is when treatment we advise to patient. Usually we advise patient, if you are using Sensodyne, apply it all over your tooth surface where it is hurting too much, and wait for 5 minutes. Do that in the morning and night before going to bed. So enough of the sodium fluoride or the potassium nitrate will be there in your saliva and will be there on the tooth surface, and it will help to tubules to block. Okay, so usually we ask patient to continue such toothpaste for a period of 1 month, 2 months or 3 months depending on their severity. Second treatment what we do at our clinic is Viva Sense therapy. So Viva Sense therapy, where it is a company product from Ivoclar, okay, where it acts as a varnish or try to coat the surface of dentinal tubule so that there won't be any sensitivity. So basically it is applied on the tooth surface. It is non-invasive procedure, no injections or no anesthesia is involved. We have to just coat the tooth surface and wait for 20 minutes. We have to reapply the solution after 5 minutes and again wait for 20 minutes, and that's it, it's done. And with the help of floss, we try to do flossing immediately when we apply the material, so that between the tooth also, if somebody is having sensitivity, that material flows in between two tooth surfaces also. So it is a painless procedure, hardly done within span of 40-45 minutes. Okay, that is the Viva Sense therapy. Third procedure we commonly do at our clinic is a laser desensitization with the help of diode laser. So with the help of diode laser, we try to desensitize the dentin Okay, it is with the it is not exactly the altering the tooth surface, but altering the neural transmission nerve mechanism, that is slightly desensitizing the nerves. So that can be done with the help of diode laser. So that is third procedure very commonly we do at our clinic in the cases where too much of sensitivity is there. So hope this video must have helped you to understand why sensitivity occurs and what you should do, or what are the common procedure done for the sensitivity of tooth. Keep watching, do like my channel, share it. Bye bye, take care.